Good morning, Year 7. So, we're going to carry on with our final lesson on human reproduction, and that is on contraception and drugs during pregnancy. So far, we should have some idea of the structures in the male and female reproductive system. We should know about the general structures of the sperm and the egg. We should know about the menstrual cycle, and we should have learned last time about fertilization and pregnancy. Today, we're going to carry on. We're going to finish off. And there's 5 questions here just to start off. So pause me and just the answers at the back of your books. So, I apologise, the first question shouldn't be that, but I haven't confused anybody too much. The last 4 are the ones we're going to do. That's my fault. The function of the testes is to produce sperm. The function of the vagina is for sperm to be placed there during sex so that it can swim to the egg. Fertilization normally occurs in the oviduct or in the fallopian tube. It's the same thing. And what day of the menstrual cycle does ovulation occur? That's day 14. You can say 13 to 15, any number in that range. Fine. Then we move on. Now, we're going to talk about contraceptives. Now, I'm afraid we're going to fly through this. Usually we'd have a whole lesson on contraception. We'd have time for that on this topic, unfortunately. We will talk about contraception in more detail in citizenship lessons going forward. So this will not be the only teaching you have on it, just the first of several lessons, because we also cover it in Year 10 biology. But we're going to fly through today, I believe, 5 kinds of contraception. Now, the first thing you have to understand is what a contraceptive is. A contraceptive is a method used to prevent a person becoming pregnant, prevent a woman becoming pregnant during sex. Now, this is fairly complicated in terms of the way it works for some of these. We're going to go through it in small level of detail. So we're just going to touch on 5 ways that a person could prevent themselves getting pregnant. And here we go. So the first way of preventing someone getting pregnant is using something called a barrier method. Now the most common one, and the most one you probably have heard of, is called a condom. Now a condom fits over the penis. A diaphragm fits inside of the vagina. Either way, the whole point is it's basically just a plastic bag, and it prevents the sperm from getting out of the vagina into the cervix and swimming to the egg. And at the end, you take the condom off, you tie it up, and you put it in the bin. Same with the diaphragm, you just take it out, you tie it up, you put it in the bin. But it stops the sperm from escaping. It's a wall that prevents the sperm escaping, and it fits over the top of the penis. It's penis-shaped or inside the vagina. So the first thing I want you to do is I want you to write down those notes. And then I'd like you to have a think. I'd like positive and negative. Why might this be a good way of preventing pregnancy? And what might be a negative about this? If you think about this a little bit, it'd be probably easier on the later ones. Just have a go at this. Why might I think, yes, this is a good way of stopping someone getting pregnant? Why might I think, no, there's some downsides. I can see some downsides here. To try to write at least 1 positive and 1 negative. So just pause me now and do that. So, let's have a look at this then. Positives and negatives. So positives to this, no STIs. Now what do I mean by STIs? I mean sexually transmitted infections. They're also called STDs sometimes, for sexually transmitted diseases. In either case, it's just a disease that is passed on through sex. So usually in the fluid of the sperm or in the fluids that are found inside of the vagina. Now condoms specifically prevent STIs. Now this needs to be changed slightly because diaphragms do not, but condoms do. They prevent STIs. So it should be that it's impossible for you to get any nasty infections, for a person to get any nasty infections such as gonorrhea, syphilis, chlamydia, even HIV, if you wear a condom. And if it's used correctly, positive, 0% chance of pregnancy. It's impossible to get pregnant if it's used perfectly. However, in reality, that never happens. Now, condoms are put on during sex, and the fact of the matter is that pretty much from the first time that a man even thinks he might be about to have sex, small amounts of sperm is released from the urethra onto the tip of the penis. The point being to slightly lubricate it, to make it slightly slippery. Now, what that means is that as you're placing the condom on, you can get a little bit of sperm on your hand, you can put them on the outside. If you're not careful to put the condom on very early enough, then sperm can be placed onto the woman. In any case, there is always very low chances that sperm actually gets onto the outside of the condom and gets into the vagina and into the cervix. That would tend to be very small numbers of sperm, and it's relatively unlikely. So you're still talking to the high 90%. That means around about 2 or 3% of people, maybe up to 4% of people, will get who use condoms alone will get pregnant each year. So if a person is just using condoms and no other form of contraceptive, there's about a 3 or 4% chance that they will get pregnant that year. Now, let's move on. Hormonal methods, and we're just going to do the same again. So, these are slightly more complicated. The condom is basically just a plastic bag. There's no difficulty there. It's a penis-shaped plastic bag. Move slightly, excuse me. There we go. With the hormonal methods, these are a little bit more difficult. Now, these release hormones, which are basically like chemicals that go in your blood, into your blood. And what these hormones do is they prevent the eggs being released from the ovary for the most part. Now, there are other ways that these can work. We're going to focus on that for now. They prevent eggs being released from the ovary. So, positives and negatives. Now, we've got to think, we're talking about a pill, i.e. something you have to take every single day. We're talking about an injection, something you might have to go to, well, you will have to go to the doctor to have. We're talking about a patch, something you have to remember to put on every day. So what are the positives to that? What are the negatives to that? So pause me and have another go at this. And make sure you get these notes down. Fine. Positives and negatives. Positives, these are very effective. You're talking high 90% again. The second positive is that actually, you don't know this obviously, but they decrease the chance of various cancers in women. Ovarian cancer, uterine cancer, various cancers actually are less likely if you're taking hormonal contraceptives. And there are other positives. For instance, they can prevent heavy periods if you're bleeding a lot. Some of these contraceptives, some of these hormonal contraceptives can stop you bleeding so much. Negatives, it doesn't prevent STIs, and that's very important to understand. Only condoms prevent STIs. So you can still get HIV, chlamydia, gonorrhea from your partner if you're taking these. Secondly, you've got to remember to take the pill or the patch. If you are somebody who is disorganised, if you are somebody who forgets to take it in the morning, you're not covered for a prolonged period of time after that, several days usually. With the injection, obviously, a negative is that you have to see the doctor in order for it to happen. Which with condoms, obviously, you can just buy them at the shop. Any shop, pretty much. And they can have some side effects for some people. Some people suffer changes in their mood, some people suffer other problems, but in some cases, for some people, the pills or patches or injections can cause negative side effects for them. They can make them feel unhappy, or they can put them in some kind of discomfort. Right, 3 of 5, I believe, IUDs. Now, intrauterine devices. Basically, what this is a little bit of copper usually, or sometimes it actually has a hormone attached to it. But we're not going to go into that one right now. We'll focus on the copper one, which is placed inside of the woman's uterus by a doctor. So it's threaded up through the vagina, through the cervix, into the uterus, hooked on in place, with some little strands that come out so it's easily removed by the doctor. And what this does is, basically it kills all the sperm. Now, there's various fairly complex reasons for that. but we're just going to go with this kills sperm. Now, one of the reasons for that is because it makes the cervix mucus much thicker, and so it prevents sperm getting in. Now, this is going to stop sperm meeting egg. So, positives, negatives, and notes. Have a go, please. Fine. Positives and negatives. Positives. They last a long time. So if you put them in, they last a long time. What you might have written is that you don't have to think about it every day. Once it's placed inside, it lasts a long time. 99% effective. Very effective. It kills sperm. Negatives, as with all the others, does not prevent STIs except the condom. Another negative is embarrassment. Okay, so if I said to you that there is a contraceptive that you can take, but that in order for you to take that, it has to be inserted into your anus, into your rear end. It will last forever, you never have to think about it again. Do you want that, or would you rather use a condom? If I said that to most men, they would say, well, I would rather use a condom personally. So it's the same for some women. Some women do not like the idea of this because you have to go to the doctor, you have to get it inserted inside of your vagina, into your uterus. And whilst doctors are quite happy to do this, they do this every day, it can be unpleasant for some people, they find it embarrassing or uncomfortable. And whilst that's not necessarily reasonable, at the same time it's very understandable. And so some people would prefer not to have that done. And on the other end, removing it with a condom, you can just stop using them. If you want to be pregnant, if you want to have a baby, you just stop using them. With the IUD, you have to get an appointment to have it removed. It can be relatively difficult to do, particularly nowadays with less appointments available. Right, so 2 more. So, second to last one, surgery. Now, this is a slightly extreme version of contraception, but it's quite common. The only one they really do nowadays is vasectomy. Particularly in Britain, they don't tend to do a tubal ligation anymore. Basically, you want either to cut or tie off the sperm duct to prevent sperm getting out of the testes and to the urethra. Or you want to tie up the fallopian tube to stop the egg getting through. As I said, the vasectomy, the male one, tying up or cutting the sperm duct, is far, far more common. The point is that this is for people who have decided, right, let's say I've already got 3 kids, I know full stop, 100%, I do not want any more children ever. Maybe I'm 40, 45, I've had my kids, they're all in kind of secondary school now, I've decided no more kids because I don't want to start again with a baby, and so I'm going to have a vasectomy. And that means no matter how much I don't use a condom and I don't use a pill, I don't think about it ever again, it's physically impossible for me to have children anymore. Obviously, it's not used very much by young couples, because unless you're certain you never want to have children anymore, you should not do this. And this is something a doctor will talk to you about extensively if you ever did decide to, in many, many years' time, to go and think about this. They talk you through the fact this is fine, are you sure you've thought about it, are you certain you don't want to have any more children, and so on. But most people, when they've decided this, it's fine. Now, it's permanent, it's lifelong. Great. So can you write down these notes and tell me what's the positive to that, what's the negative to that? So, positive. It's 100% effective. Okay, it's one of the only 100% effective types of contraception. It's this one and the next one we're going to talk about. No hormones or thought required. So you don't have to think about it ever again. There's guaranteed no thought required. And extremely long-lasting, lifelong. Okay. Negatives, still doesn't prevent STIs because the STIs, the infections, are not in the sperm. They are in the fluid released, and the fluid is still released from the glands. Not repairable. If you get this done, you can't undo it. It's not possible. So, last one. Now this one is the perfect form of contraception. Guaranteed, it's impossible for you to have a baby ever, ever, ever. And there's only one way that does that. Not having sex. Now this is abstinence. Now this is the final type of contraception we need to hear about, and it is choosing not to have sex. 100% guaranteed not to have a baby. Now there are some crazy rumours and half-truths going around, not even half-truths, not truths going around, fake stories about people getting pregnant who have not had sex. Things like there's some sperm swimming around in a hot tub, and a woman gets into the hot tub, and sperm swims inside the woman, and she gets pregnant. Now these things are just not possible. It's just not true. And so abstinence, i.e. not having sex, will guarantee that you are not capable of having a baby. Positive, negatives, notes, last one, write it down please. So, positives, 100% guaranteed. Negatives, prevents an individual having sex. So, there's positives and negatives. Fine. Now, that's the end of the contraception, and we have spent 16 minutes of the video on that. I would anticipate you having spent maybe 25 minutes to half an hour on this so far. So I'm hoping you have about around 20 minutes left for this final task. Now, this final task is a short research task. And it is on drugs in pregnancy. Now I'm going to touch very quickly on illegal drugs. I'm going to ask you to research alcohol and smoking during pregnancy. So, the first thing I want to talk about is what happens if you take illegal drugs during pregnancy. Now we're talking about cannabis, heroin, cocaine, anything non-tobacco and alcohol, basically. Okay. Now, there are other issues with drugs that are legal, things like caffeine. Actually, can cause issues, but we're talking about illegal drugs. So, drugs affect the child because a lot of them pass through the placenta. So we said that the way that the baby gets its nutrients and oxygen is through the mum's blood, almost touching the baby's blood and things passing across. Same thing with drugs. If you take a drug that gets into your blood, which all drugs do eventually, then it will get into your baby's blood almost all the time. There are very few drugs that don't. So what you have to think as a pregnant woman is, or as a partner of a pregnant woman, would I want to feed this to a baby? Would I want to give a baby cocaine? Would I want to give a baby heroin? Would I want to give a baby alcohol? But we're focusing on the illegal ones for now. So issues, things like preventing the amount of oxygen getting to the baby. I mean, if you get less oxygen, you can't grow properly because oxygen is used to release energy for growth. It can damage the placenta, and if it damages the placenta, it can cause severe bleeding and it can kill the woman, it can kill the baby. And with some drugs, very rarely, particularly drugs that are extremely addictive, things like heroin, the baby can actually be born effectively addicted to heroin, i.e., if you take enough over a prolonged period of time, because the baby is getting a constant hit of this drug, this addictive drug, take heroin as an example, basically they're born having taken heroin for 9 months. And that causes A, serious harm to the baby, and B, can make the baby extraordinarily miserable. Right? When you stop taking addictive drugs, you get withdrawal symptoms, you get angry, you get depressed, you get irritated, and it causes physical symptoms, discomfort, unhappiness, and so the baby can suffer from those as well. Now, I don't want you to write this down because I think this is actually the least important of the three. Very few people would take illegal drugs during pregnancy because few-ish people take illegal drugs full stop. The one that isn't, the two that are issues are alcohol and tobacco. And these are the ones I'm going to ask you to research. What I'd like you to do, I'd like you to go away and just like you did with your scientist, I'd like you to research two things. Now you need to listen to this carefully. Firstly, I'd like you to research how smoking can affect pregnancy. Now, I am not asking for a page. I am asking for 2 or 3 sentences about how smoking can affect pregnancy. And I need you to find one good website that is not Wikipedia or Google, a specific website, a good one that is reliable and trustworthy. And I need you to write that source at the bottom of your page. So you should have smoking can affect pregnancy because it gives babies wings and makes them fly. Full stop. At the bottom it should say www.fakenews.com. Right? Whatever you find out, a few sentences maximum, and this should take you no more than about 5 or 10 minutes. The only rule, you need a source and none of it should be copy-pasted. If your teacher can find that it's copy-pasted, i.e. you've just copied somebody else's work directly, that's an issue. You have to write it in your own words. Secondly, how alcohol can affect pregnancy. Now, it's exactly the same, so I'm not going to go over it again. A few sentences, one source. If you can't remember how to source things and you were in one of my classes, you can go back and find the video that I posted about sourcing. Very broadly, just don't copy and paste. Read it, close the web page, think about it, and then write out what you remember. And write the website at the bottom so I know where you got it from. Right, and that's the end. Okay, I'm going to ask you to research that. You're going to return it to your teacher, and they're going to feed back to you what they think of your research. Right. I hope this course of lessons has been interesting to you. If you have any questions, please keep contacting your teachers. They're always interested to hear. And I will look forward to seeing you all back in school at some point in the near future.